As Canada's emergency rooms grapple with long ER wait times, a Winnipeg doctor shared his frustrating first-hand experience. Dr. Doug Eyolfson from Grace Hospital calls the overcrowding at the hospital's ER this weekend a catastrophe. He says when he was leaving his shift Sunday evening, there were 52 active patients in an emergency room designed for 30.
The department was already, full beyond capacity, and then large numbers of patients came in during the day. So by mid-afternoon, we had almost double capacity in the department, and then 40 patients in the waiting room.
He says there were no beds to admit patients, and they had to wait on stretchers in the hallway. Eyolfson, who's also running for the Federal Liberal Party in Winnipeg West, calls this a major hole in the system.
I'm angry. I'm very angry when I see that. There's no excuse for this.
Eyolfson says most of the cases this weekend involve seniors with minor injuries who are often too fragile to discharge home. He calls for improvements.
The answer is not, more walk-in clinics. We do need more of those, but the answer is not that. That's not going to solve emergency department crowding. We need increased funding in inpatient bed and long-term care capacity.
Manitoba Nurses Union President Darlene Jackson says longer wait times are unfortunately becoming a normal everyday situation.
There is nowhere to move those patients. There's no beds to move patients into. So there's always a bottlenecking and a backlog in the emergency department, patients that are admitted on beds, waiting for beds within the facility.
Jackson says amid a staffing crunch, the province needs to recruit more nurses and retain the ones already in the system. Zabina Ahmed, CBC News, Winnipeg.